Hi, Akil. I have to do Zoom today because I have another meeting there tonight. I can't do two. You hearing me?
Hello, Lydia, can you hear me?
Yeah, I can. I just want to say I had two meetings today, so one I have to do tonight. So this one I'm doing Zoom, okay? I'll be there tonight,
All right.
just to let you know. Hello, fellas.
Hi. Right. I'm part of it, yeah.
Okay, something on the air about the new culture.
Yes, I'm Parks. Yeah, co-chair of Parks. Yeah. And, when
The
you,
kid is from the library.
right. So far.
Great, make time available accordingly, and I'm here. So, you know.
And you have to squeeze it in while you can, or where you can.
Oh, I love it, instead of, you know, because if
That's so funny.
not, I can watch TV and
Oh.
kick my feet up and take a couple of naps, you know? But I'd rather be, you know, active in the community like I've been since, 2009.
You've been on the board since 2009?
Various ones that connects with
Okay.
community board now, like, One Side Area Lions.
Okay.
I was 7 years on
That's
his.
still around, right? Morning
Oh,
side,
yeah.
yeah.
They, doing real good with the, event digest. You're able to, pick up a lot of information on what's going on, you know, ballets, you know, from arts and culture all
Okay.
over.
Are you also in arts and culture?
Yes,
Okay.
yes, I'm, a community member of that also.
Oh, wow.
So. And it's fun, mine is a continuation, you know, they appointed me Matt for president and then the city council appointed me to, you know, after I finished with, Grant House, our 7-year TA president.
Oh.
So I used to do all
Who
the
you
trips.
before, what's her name?
Sarah Martin, after Sarah Martin.
Okay.
Yeah, so I did 7 years, as TA and, you know, took them on trips all over the place.
Okay.
Everywhere, so I'm known for the Lion King, Aladdin, Poconos.
Oh, that's kind of cool.
Yeah, Sight and Sound, you know, all arts and culture,
Right.
and the seniors, led the charge. Always.
Yeah.
They led the charge and stuff, and the kids followed, then the parents followed. Parents like, hold up.
Look at that, it's the sequence, senior children, parents.
This is
Yeah.
grandparents, children, and the parents get up. We all went, oh, we just came back from Hershey Park.
Right.
You know, took them 3 times. You know, Jake to the Poconos twice.
Okay.
And then, you know, the parents, scratched like, okay.
Just made it.
You guys went skiing, snowboarding, or skiing, or just?
No, we went to the indoor, water park.
A water park?
Yeah, in the, winter time.
Sure, thank you, sir. Well.
In the winter, we just party and have fun, everything, all expenses paid, the CPA has a certain amount, allocated for grant and Manhattanville. We got a grant and Manhattanville, you know, I signed off the, documents and.
Is there still funding available into that? Is there still funding available into that CBA?
It should be, because I left a lot of money.
Oh, you did.
And I got built the CPA up. Hey, how are you? Quarter of a million. That should be a lot. We have the event, yes. I haven't done anything now. We got some donuts, I got the munchkins, and I don't know if everybody. That's what they do, that's what they do. That's good. I'm glad I can get it. Nobody. No, I had a permanent clean to cancel, so I had already asked to be virtual. But then I called back and confirmed my dental appointment, and I had canceled that too. Because I thought I was gonna be able to do it too. I just come from the second. Hi, how are you? It's something wrong. Put it over here, not on your desk. Yeah. Put it over here. Like I said, here. A little rusty. Right here? Yes, right here. Yeah, we can't. Oh, I get it.
Maybe they told it.
I remember how far you. In a wonderful time of your life, it was.
Yeah, man, it's already.
Oh, yeah.
That is theory. It's going to be. Yeah, we the way they built it.
How are you? My sister. How are you? And highly favored. You know. And highly favored. You know, God has only done great wonderful things. Exactly. You are so hard. Hey, how you doing? I feel. I'm good. It's good to see you, my God. Same here.
Yeah.
So how did you, what did you think of the Lion King?
It was my first time seeing it in the theater. It was good.
Yeah.
I thought that Disney would spruce it up a little bit more, but it was good. Now, I won't complain, you know, and, it was very nice.
Yeah.
Being in the men's co-op theater, and Junior's was right next door.
Exactly.
So,
I didn't
you
get
know,
a
I
chance
got
to
it.
go, but I should have, yeah.
It was worth it, it was worthwhile. And all those people who said, oh no, it was for the seniors, you know they brought their kids. I didn't even say anything, come on.
Yeah, and you know what, cause I know there's so many people with kids that ask me, like, people want to bring their grandchildren, I said, no, it's only for seniors.
Let me tell you
But then
something.
people do bring it, and I'm like, well, you know, I don't regret following rules, if you know what I'm saying, you know? But I just wish that I had that opportunity, extended that opportunity to other people as well.
Well, I find that, a lot of, as a child.
Anyone,
Yo,
sorry,
I-
anyone want coffee so we can kind of tilt this on the work?
Yes,
It's overflowing and it's dripping.
I know, I'm.
So
okay.
you
Maybe
want-
I'm
I don't want any coffee, I'm going to-
I always,
You got to do that.
but
It's supposed to,
I let them know
Yeah.
that they could go,
Things up the way the bag is inside.
but we would not, put them on the bus.
toss me up.
Yeah, we're pretty.
All of those kids, I don't care if they're 13, We cannot put them on the bus, and all of the people, so we give preference to the seniors, and the seniors will take bus, everybody else must take
Doesn't go on
public
public transportation. That's a
transportation.
fair compromise.
Yeah,
Yeah.
I said, no, now, this is supposed to be a thing, but I'd rather us use that money than not use that money.
That's true.
Okay.
Yeah, I understand.
That makes sense, right?
It does.
Okay, because if it should come to funding, there are other venues that if an account is kept on how much money is spent, that we can do it for these few years, we can get additional funding going forward, even though Columbia.
Yeah, yeah, that's true.
We want that money. So that overflow. That's I've been to many places. I told my mother about my kindergarten, because she doesn't like to really, you know, that's back in the day. And racism was that.
tissue over there.
But I was a sensitive guy. She doesn't like me. I raised my hand like you taught me. My mother had black living room teachers how to learn. You know, and anything that I, nothing was proper. The teacher would ignore me. And they put this guy in first grade because he could spell. I said, Mom, I can read. They didn't know he could. I said, I don't want to go there anymore. So she took me to place.
And you know what, that's a whole other conversation, but how we have to teach our kids differently,
Yes,
and we have to teach them to prepare for certain things.
yes.
And it hurts, hurtful.
Eh,
But because then how do you explain to them, why are we being subjected to this? You know, and, cause I'm gonna give you a good for instance, I live, right here across from Riverbank, right? And one time my son and his friends were coming, they went to the park, they did their homework, went to the park, came back. But then he stopped them, pushed them, so they thought that they were looking for somebody else. And my son was like, well, what's your do? And you know how old they were? They were in elementary school, so maybe the fifth grade.
Yeah, they did it to my son too, so I brought up the fact that I did really want his father.
Yeah, yeah.
And now she harassed my son, he didn't want to show him. But I said,
Yeah.
no, you don't harass him,
Yeah.
and I had to put him in and not only that, I had to put him in private school. I didn't let him be educated, because I couldn't go to work. And yeah, him undereducated, and I couldn't stay home.
Happy belated Veterans Day.
Oh, okay.
Thank you for your service.
And I made sure that, I educated him, but also he had structure, I educated him about. Yeah. I educated him, put him in those private schools, they didn't have fun, but, you know. So I brought, you know, he's not overdid it. You can read the newspaper. Yeah, it was a lot to do with his education.
You guys afraid to get this?
But when you're talking about like this girl got this, so she could spell it, you can read, that's beyond stuff.
He could spell, but I could read. I was reading at the time, in kindergarten, I would be like a fourth grade.
Well, you know what, I remember
And
my parents told me that they didn't know I could read until I read President Kennedy was killed or something.
Right,
I read that to them. And my mother said, Brenda, read that again, and I pointed out the letters.
That's the word.
And then they said they didn't know I could read.
Yeah. My mother knew I could read. And but the fact that they ignored me so much, they didn't know me. But. They had a lot to do. Black women. They had. They believe I had 100% on the family and
Something must be wrong.
no, so they made me take it again. They made me take it again. I go, you didn't even have to give me a different test. They did the same test.
You didn't have to say, you know
I
what?
had 2 wrong in the first. I got them correct in the second.
Wow.
And then they asked my mother, could they give me the sheet? Oh, my goodness, they removed them. The mother said, no. I'm so grateful she did that. At first I said, why not have to look at the house?
Are we informed?
Is the quorum here?
Or?
You're not, this is not, he's not, you're not going to be senior.
No, you have some other, You can look and see.
There's
Someone
Lydia
else.
Lydia's on.
It's on.
and Victor.
Victor's not part of the committee, but.
But he's,
Well, he's
he's,
part of every committee. I
I
thought you
know,
were
but it's over there.
formed from, okay, okay.
and how many are in our group? That's what we try.
8.
Eight.
So you have.
You need 4 or 5.
No, we need 4.
Five,
He's
five
not
or
one.
7.
Lydia.
Come
Okay.
on, folks. I couldn't do 2 today because I have one tonight too, so I could only come in for
Pick one.
1, so.
Good to see you, Lydia.
All right.
Good to
I don't-
see
I don't know
you.
about this Zoom, I'm pre-Zoom.
You need to go to recording.
I'm a pre-Zoomer.
Record.
I did everything,
She recorded. Okay.
I don't know where it's at. But that's now.
It's recording.
Oh, it's recording? My bad. I'm a pre-Zoomer, so. I don't want meetings with like, it's right here, up close and personal. Okay. We're gonna call the meeting to order. We have a quorum. Lydia. She's there. All right, and, we have, Mr. Eric Hausman from the Department of Aging. He's gonna do a Medicare orientation.
Oh, good.
And, we're supposed to have some people with a senior update from Lilly. They had an award gala, which is basically an announcement. I can get that right quick since I don't believe any of them are online at this time. And, it was beautiful. Melba from Melba Restaurant, she came, she brought her entourage, she spoke highly about our seniors to stay motivated. Mostly was an encouragement, uplifting, and, to keep whatever we doing that's going good for you, keep doing it.
That's good.
And then, we had, Mayor Kavanaugh, she spoke in representation for Dr. Ruth, Westheimer.
Wow.
And you know, I didn't know she lived in Washington Heights.
Yes.
Yeah.
I did not know that until she
That's
passed
so
away.
cool.
She lived in Washington Heights.
Yes.
They gave
Amazing.
her award
Wow, thank you.
posthumously. And, you had, the Sopranos was there. Well, you know, yeah, they were there.
Yeah.
You could tell they were there. And they gave a good, shout out to everybody, stay strong.
I was there.
I know, I was there, you're not the cameo, I wanted to bring you in as the entree.
That's the underrated.
And Cena was definitely there in the house.
All right.
And, you had Danny O'Donnell, you know, I gave him, a little dat, and, Gail Brewer showed up.
Oh, nice.
She
Which was
always.
beautiful,
She's
yeah.
beautiful, yeah, she's really
It
represented.
was just beautiful for that Lily's update, for us seniors and us upcoming seniors. You stay strong, keep doing whatever's doing right for you. That's what I got out of it. It was very uplifting, you know?
It highlighted the concentration on older adults, like 85 plus, that they're basically their target population.
Right.
But they do extend their arm further than that, to include those,
Right.
seniors, period.
Right, right.
And it talks
And
about
who do they consider senior?
seniors, they consider the same age, but they just concentrated on those that are 85 and above to care for them, to supply companionship, mentorship, aid them in any computer, illustrations or
Right,
problems or
right.
executions that they may need.
That's nice.
It actually take them to quite a bit of culture events. I'm glad they're now a part of us, but they did a lot of things locally that Columbia supported, Riverside Church supported. And they have, donors that do different activities concentrating on
The
those that
age.
they're in their care for, sponsored program.
That's great.
And,
Yeah,
I worked 7 years with them as Grant TA president. They came to every meeting for 7 years,
It's nice.
along with, the DA, Cy Vance and, his team, Renee Woodbury and Mr. Shuey.
Mhm.
So, we kept a strong
Nice, good
connection.
tie. Yeah, that's good.
Good
That's
times.
good, that's good.
Julie and-
We remember it.
the dance
Yeah.
at the 113th Street and Broadway Branch Library.
Right, right.
So some of the programs are geared out of that also.
And
Let me go on just a comment about the
Sure.
elections as relates to seniors.
Sure, we got a little time, cause, Mr. Hausman to take over and his orientation probably can close us out.
So I was on site at,
Old business.
yeah, this should be new. I was on site at Jackie Robinson Park for early elections and another site for election day. I think for the seniors, the proposals were extremely difficult.
Yes.
And, had the weather not been the way it was, I really don't think there would have been the senior turnout. But my thoughts, I walked away with two things, really to get more seniors to do a mail-in and also to create more community-based kind of grouping prior to elections to discuss the proposals, maybe assist with the mail-in ballots. But had it rained, I really think it would have been a low turnout. And some of the seniors that showed up, in my opinion, God bless them, but they should not have. That site, Jackie Robinson, is not an easy site to navigate your way through.
Jack Robinson?
Yeah, so they're using the rec center now for early voting, but you have to come into the pool area.
140 this year.
Yeah.
So we filled Jack Robinson.
Yeah, that's
That's
Jack
interesting too.
Yes.
I'd like to make a comment,
Yes.
because, I've been up here for 45 years. I'd like you to know that in this, the demographics of this community, the largest voting, group are the seniors.
Right.
They show up, they volunteer, and even though you might not see them there, I know in the neighborhood that you're in, which is Sugar, which is just below Sugar, but that's where Sugar Hill voted. That the seniors vote all the time. The churches, they ride, the NAACP had free lift rides to the voting polls from the churches, in New York City. We are very, very active in the vote, and we have a very strong, because we are based on the church and everything, we are solidly founded in the politics and the rights and the civil rights of people,
Right,
especially people of color.
right.
So I think, of course, coming into maybe next year, when they go in for mayoral, if there are any issues like ballots, or if there's early elections, or if there's mail-in,
That's well
maybe
taken.
a couple weeks or a couple of months prior,
We could do
a
something.
big push on it, yeah.
Well, you know what, you bring out an interesting point, because as I'm listening to you, I'm thinking, back in the day, the Democratic, I'm saying Democratic, but I mean the political clubs. The
Right.
political clubs used to have those type of discussions.
Yeah.
Where the official, they were like, where would be different officials would come and say, okay, this proposition or whatever, this is what, we want to explain it to you
Right.
and let you know what's gonna happen, you know? That's something that used to happen before, I don't know if it still happens.
It still happens.
But I think it's a good idea for there to be a community type meeting where
Right.
everyone can get access to it. And it won't be partisan based on political party or anything.
Right.
It would be, this would be
Informational.
advantages of, should we vote for Proposition 1,
Right.
2, 3, 4, or whatever? This is what the positions are.
Well, you're absolutely correct, because none of that was addressed. Some people voted for all of it, yes.
Because they didn't know that.
Then 2 through 6, I believe, is detrimental. I believe that all that power should be given to the mayor. I don't care what mayor, all the way back to Mayor Bean. I'll go back that far too, y'all. And, I just couldn't understand
She just did a thumbs up for you.
the power
Right,
play.
definitely.
Yeah.
That was a power.
Yeah, I go back to Mayor Lindsay.
I do
Okay,
believe,
so-
There you go.
There you go, there you
I
go.
do believe that,
Uh-huh.
I do believe that, and not trying to overtalk politics, but, this is a New York City being a blue state.
Is that true?
The Democratic club that we have, especially in Harlem, is very strong and well established, under the, Harlem Chamber of Commerce. There's a lot going on, so if you are not of the blue, then you know of it.
Right.
Yeah, so and then the other thing, if they're senior needing a mail-in, they're actually very easy, right? Because I just took out my cell phone and I did a bunch of mail-ins, but I don't think the seniors, a lot of them are tech savvy enough
Right, enough.
to do it. But the good thing about it is when you make that request, you can track it.
Right.
So that I thought for those who did go through that process, it was great. So I think, again, we were blessed by good weather. And if that were not the case, I don't think the turnout would be high. But so for the next election, I think you just need to drive on that. Even if it's a community group that can assist with getting the mail-in ballots out there.
Well, they did in January, I think it was the first early, 26th of October. They had seniors and those that were disabled come in and do their mail-in.
Oh, excellent. I like that.
They did assist them. But I thought the booklet was excellent
Yeah.
for those who could comprehend it. Because most New Yorkers didn't even know what the content was.
Yeah, but one that I saw that said pros and cons, you know, like proposition
New
one,
York,
yeah.
The New York thing, yeah.
Right, and they said, and yeah, we've always been very active in the politics of it, and not only that, we use our churches as, I don't know about other churches, but Baptist churches is used as well as a town house.
Right.
A meeting center, and we do address issues that concern our neighbors and our neighborhood. So it's been a long existing thing. So let's say for the last 80 years, we stand strong. It's just that if you're just in, you might not understand it, but maybe you introduce you to some of the other, some of the people, some of the things that go on, but in us, we are also, with the seniors, we are proactive in informing. Each one of us here, works as a community leader. I can safely say, right?
Yes. And a significant number of folks showed up who were not registered. Not seniors, but a registration drive
Yes.
would be excellent.
Mhm.
That was kind of surprising. Lots of issues with affidavit ballots.
Yeah,
and
a lot.
A lot, and a
I
lot
think
of.
we had 71 at one table.
Yeah.
Wow.
yeah.
Really?
These are incredibly high numbers, yeah.
I chose not to. Work.
My
This is the
first time, first
in-
rodeo.
No.
First rodeo.
This is the first time in say 15 years, I did not work.
You have people
Yeah.
that moved to the Bronx and still coming back here.
That's right.
Right.
All of
That's
this.
just for clarification for me.
Because I saw all my
What we're talking about.
alumni, my girls, I said, you guys don't live here anymore, but we never changed our address, so they were coming back.
Right.
So that's what the voting early process is about, and the
Yeah.
computerization
Right.
of the vote, because
Right.
therefore, if you vote early, you can say, look. And they know that wherever you are in New York, in that vote, you're registered in New York City.
Right.
And therefore, you can say, I no longer live there, and on that computer, they can change your address
Exactly.
and put you in your right voting place, but you can still vote.
My wife and I was the only one in Grant houses that they couldn't find our names.
Wow.
But you know Michelle, anybody know Michelle?
Mhm. Mhm. She wasn't happy.
She wasn't happy. All of a sudden, mysteriously, Carlton Davis' name pops up. And stuff. And I was.
But there
able to
was
vote.
there were a lot of seniors bringing in their parents that could hardly walk to vote.
Yeah.
And so there was a lot of
And those are the early voters, those are the.
No, this was November 5th.
Okay.
Wow.
No, I'm talking about them in early, like
Right.
6 o'clock when the polls open.
No, they were there like 7 and 8.
Oh, that's good. That's
Yeah,
good.
no, I know. But I mean, I was like a first time poller and worker. I mean, I was just.
You were surprised to see that, oh no, they go, that's the main people that vote
Yeah.
in our community, the older people, yeah. Okay.
All right, we good? We got clarification on, everybody has clarification on the seniors and the political structure and the disadvantages that they went through. We just, had a brief announcement based on that, statements made on that to be recorded. Mr. Hausman from DIFTA. Are you there?
Yes, I am. Good morning.
Good morning, how you doing?
I'm fine, thank you. How much time should I spend today speaking?
Well, we got some good time. We covered, announcements and, as part of that structure, what we do on a regular. Everybody know who we all are, I believe. Unless y'all wanna do an arts and culture announcement and give a small presentation. Because we're gonna let you take the floor and basically carry us out until we do old business, new business on this one.
Okay.
Okay.
And what time should I figure that will be?
That should be now.
Okay. So,
We can start now, sir.
sure. So I'll get started. Thank you for having me today. My name is Eric Hausman. I work at the New York City Department for the Aging with the HICAP program. It's HIICAP. And we have volunteer counselors that help people with questions on Medicare. So if you or anybody in New York City ever has a question about Medicare, you can reach one of our counselors by calling the Department for the Aging. It's 212-AGING-NYC. I'll put it in the chat. 212-244-6469. And if you ask for HICAP or you mention Medicare, they'll put you in touch with one of the counselors. So I'm just going to provide some updates on Medicare for 2025, and I'm happy to answer any questions that you might have. So starting from the very top, you may know that Medicare is a federal health insurance program. Mostly it's for people that are age 65 and over. And there are two parts to Medicare. Part A is your hospital insurance, covers you if you ever have to be admitted to the hospital. Part B is your medical insurance, covers you mostly for doctor services. Part A, for most people, it's free, it's no premium. Part B, there's a premium. And they just announced the new premium for next year. So this year, the monthly premium for Part B, it's $174.70. Next year, it's going up to an even $185. If you're collecting Social Security, that's taken out of your monthly Social Security check.
Well, that's monthly,
That's a lot.
It is a lot, and I'm going to talk about today about the Medicare Savings Program, because for people that have limited income, the state will actually pay the premium for you. Okay? But before I talk about that, I just want to tell you about some other changes for next year. So besides a monthly premium for Part B, there's an annual deductible. This year it's $240. Next year it's going up to $257. So that means the first $257 in covered medical expenses, that's your responsibility. And then once you meet the deductible, for most services, Medicare pays 80% of what they allow. You pay the other 20%, the Medicare coinsurance. That's how it is for Medicare Part B for medical insurance. For Medicare Part A, it's very different. Although most everybody gets Part A for free for no premium, there's a large deductible if you need to be admitted to the hospital. That goes up every year. This year it's $1,632. Next year it'll be $1,676. So that means for a hospital admission next year of up to 60 days, Medicare will pay everything but that deductible, $1,676. So far I'm talking about one way to get Medicare. Original, traditional Medicare, Part A hospital, Part B medical, and about the gaps in coverage, deductibles, coinsurance. Now let's talk about filling in the gap. Some people here today might be retirees and have coverage through their own or their spouse's former employer. So for the retirees today that are retirees of the city of New York, most of them have the GHI Senior Care. It acts as a supplement to original traditional Medicare. It's a combination of Anthem Blue Cross Blue Shield, which supplements Part A, and GHI Emblem, which supplements Part B. The GHI Senior Care does not cover the Part B deductible. Plus, they have their own $50 deductible on top of that. Currently, once you meet the two deductibles, the GHI Senior Care supplements the Medicare by paying the entire 20% coinsurance. But next year, that's changing. And instead of paying the entire 20% coinsurance after the two deductibles for New York City retirees, you're going to have new $15 copayments for most services. That's a change for next year. For those that do not have retiree coverage, some of them have very limited income and resources, and they might have Medicaid in addition to Medicare, in which case Medicaid can fill in the gaps in Medicare. For those that don't have retiree coverage and who don't qualify for Medicaid, they can purchase a private Medigap, a Medicare supplement plan. You may have seen them advertised from AARP. And with Medicare and a Medigap plan, depending on the plan, you could have very complete coverage between the two. Medicare pays 80%, the Medigap pays the other 20%. If you're admitted to the hospital, instead of paying that big deductible, the Medigap plan pays it for you. but it comes at a cost. Medigap insurance can be expensive. It could be $200-300 or more per month. This is one way to get Medicare. Original, traditional Medicare with or without supplemental coverage. But there's a second way to get Medicare, and that's to join a Medicare Advantage plan, a Medicare Health Plan. These are private plans that work with Medicare, and they provide all of your Medicare benefits through a network of doctors and hospitals, through doctors and hospitals that participate, that take the plan. These are the companies that send you so much mail every day, right? Whether it's Aetna or Centers Plan or Elder Plan or Emblem, right? Or Health First or Humana or Metro Plus or United Healthcare or VNS or WellCare. Many companies offer those plans. And if you choose to join one of those plans, you'll get all your Medicare benefits and some additional benefits that Medicare doesn't cover: dental, vision, hearing, gym membership. But those benefits will be through that plan's network of doctors and hospitals, through doctors and hospitals that participate, that take that plan. Now, there are three companies, Aetna, WellCare, and United Healthcare, who offer plans that are terminating, that are ending the end of this year. And if anybody is on one of those plans and they do not choose a new plan for next year, by default, they're going to have original traditional Medicare starting January 1. Now, those three same companies, United Healthcare, WellCare, and United Healthcare, WellCare, and Aetna, still offer plans for next year. And if people want to remain with a plan with that same company, they can just contact the insurer to remain in the plan. Okay? The biggest change, though, for next year has to do with Medicare Part D. D is the prescription drug coverage. If you're in a Medicare Advantage plan, Part D will be included. If instead you choose original Medicare, you could purchase a separate standalone Part D plan. Next year, these plans have, the separate standalone plans have monthly premiums. In addition, they can have a deductible, any Part D plan, of up to $590. Some plans have a $590 deductible next year. Some have a lesser deductible. Some have zero deductible. $590 is the most it could be. Once you meet the deductible, people usually pay a copayment at the pharmacy, a set dollar amount, until they get to next year, a maximum out-of-pocket limit. This is the big change for next year. For the first time with Medicare Part D, there will be an out-of-pocket limit of an even $2,000. Okay? So for people that have very high out-of-pocket cost, this is going to be a big change for them for next year. Their out-of-pocket cost will be capped at $2,000, not including the premium they pay, but including everything they pay at the pharmacy. And once they reach that limit, if they do, they will have 100% coverage for the rest of the year for all Part D covered drugs. Now, in addition to that 2,000 limit, they have this new Medicare prescription payment plan, MPPP, which all the plans will offer, which will allow you to spread out that $2,000 into monthly payments. And that could be really helpful for people that have high out-of-pocket costs that otherwise would have to pay that $2,000 out of pocket in the first month or 2 or 3 of the year. They don't have to. Instead, they can spread it out into monthly payments. And if you join this Medicare prescription payment plan, which again, all plans will offer, you will pay nothing at the pharmacy, zero. Instead, it's your plan that will bill you the same way they bill you the monthly premium. They will bill you a monthly amount for your share of that $2,000 out of pocket. Okay. So just to conclude for today, I just want to talk about a couple of programs that help people with their Medicare costs. One of them is called Extra Help, or the low income subsidy. That's a subsidy the government provides to help people with their Medicare Part D drug costs. Some people get it automatically because they have Medicaid and or the Medicare Savings Program where the state pays their Part B premium. Other people would have to apply to Social Security for that. If you get the extra help, you can get a subsidy that'll pay your entire Part D plan premium. So you can get a Part D plan for zero premium, no deductible, and only small co-payments for your drugs. If you're not eligible for extra help, you might still be eligible for the EPIC program, EPIC. EPIC is from New York State for New York State residents that are 65 and over, that have incomes of up to $75,000 for a single, $100,000 for a married couple, much higher than extra help. And it works EPIC as a supplement to Medicare Part D to reduce your Part D cost. And for most people, EPIC is a free program. So you wouldn't pay anything for EPIC. And there would really be no downside to having the EPIC program to supplement, again, your Part D drug coverage. And then the most important program is called the Medicare Savings Program. The Medicare Savings Programs for people that qualify and apply, the state will pay your Part B premium. It will put that $185 next year back into your monthly Social Security check. If you have Part B or you know somebody that does and they're not paying the premium, they're already on the Medicare Savings Program. But if not, they may qualify. So to qualify for the Medicare Savings Program, you need to have an income limit this year less than about $2,350 a month. And a couple of advantages to living in New York State. First of all, New York State raised the income limits last year so that many more people qualified than before. And New York State does not have an asset or resource limit for this program, only income. And with the Medicare Savings Program, even if your income's too high, you might still qualify for this program. Because if you're paying privately for health insurance, they allow you to deduct your health insurance premium from your income to be eligible for the program. So I'm going to include a link to a flyer from the Medicare Rights Center on the Medicare Savings Program. And that's something that we can help people with, along with any questions on, again, Medicare or related health insurance. Because there's an enrollment period going on now for Medicare, October 15th to December 7th, where people can change their Part D and or Medicare Advantage plan. And if they do, their new plan will start January 1. So I know that's a lot of information in a very short period of time, so I'm happy to answer any questions that anybody has on Medicare.
Yes, so this is a
If I may,
Yes.
let's start with what happened to Part C.
So Part C is another name for Medicare Advantage.
Part C is Medicare and D.
So, right. So let me explain. So there's two ways for people to get Medicare. Either people can have original traditional Medicare, Part A and Part B, in which case they might have supplemental coverage and a separate Part D drug plan. That's one way to get Medicare. The other way to get Medicare is to join a Medicare Advantage plan. That's Part C, and that will include Medicare Part D drug coverage. So it's one or the other.
Could you please, I'm gonna, if I may ask another question, could you please tell me, give me a figure on what would entitle someone to be able to have, to be supplemented? What is the limited income to have to be eligible for any subsidy? What is to be still considered low income?
Right. So for the Medicare Savings Program, and I included a link to that, which has the exact figures. The income limit for that is $2,355 a month for a single person. But if your income is above that, and you're paying privately for health insurance, they allow you to deduct your health insurance premium from your income to be eligible. So for instance, if you're a single person and you have an income, let's say $2,600 a month, but you're paying $300 a month for an AARP Medigap plan, you can deduct that $300 from your income, and now you're eligible for the Medicare Savings Program.
So let me see if I understand what you're saying. You said 10%. If my annual income is below 23,000. Oh, no, 2,300, 2,300 monthly. Is that what you're saying?
Right, the monthly
I would
income.
be eligible for, all help. Okay.
So if a single person and you have a monthly income limit less than $2,355 per month, you qualify for the Medicare Savings Program. The Medicare Savings Program will pay your Part B premium and make you automatically eligible for extra help. In addition, you would also be eligible for the EPIC program, EPIC, which has income limits going all the way up to $75,000, an annual income limit of $75,000 for a single person, which is much higher than the Medicare Savings Program or extra help. So a lot of people in New York qualify for the EPIC program, which again supplements your Medicare Part D.
And how does so how do you apply to qualify for this, EPIC? Yes.
Well, you can submit a paper application for EPIC, or they have a new online application now, which they recently added, and I can include a link to that in the
Please do.
chat.
Is there anything we could do over the phone?
Sure, I'll do that. Are there other questions?
Anybody else? Lydia, you have a question?
Is it,
Well-
is she answering?
I don't have a question, but I have a comment. Good morning, Mr. Hausman.
morning.
I attended the Medicare Advantage panel at the state office building last week, or a
Yes.
couple of weeks ago. And I initially wanted to let you know that I had brought paperwork, and my intention was to distribute it to everybody, but the copy is not working. So I'll leave it with you and she'll be able to get the information to everybody. But I wanted to also ask you about, there was an article that was published in the Wall Street Journal yesterday evening, and I read it this morning. And I just want to give everybody your information. The title of the article is "The Sickest Patients Are Fleeing Private Medicare Plans, Costing Taxpayers Billions." And if I can read an excerpt from this, if I can. A Wall Street Journal analysis of Medicare data found a pattern of Medicare Advantage's sickest patients dropping their privately run coverage just as their health needs soared. Many, like Green, made the switch after running into problems getting their care covered. Plans run by the private insurers in the Medicare Advantage system are supposed to offer old and disabled people the same benefits they would get from traditional Medicare. The plans can be a bargain for people because they limit out-of-pocket expenses and often offer extra benefits such as dental care. As recipients get sicker though, they may have more difficulty accessing services than people with traditional Medicare.
Right.
That's because the insurers actively manage the care, including requiring patients to get approval for certain services and limiting which hospitals and doctors patients can use.
That's exactly.
Now, I'm bringing that up. I didn't know I was going to be mentioning this because I just saw, I read it this morning. But I wanted to mention that because I think that that's an issue that the Department of Aging and anyone else who is involved with this should really be looking into. Because it's one thing to press or to push these programs, which would be beneficial. And I have no issue with that. However, we need to look at them very carefully. And we need to make sure that we know what's happening because I can send you all the article by email if you'd like. But the article, they talked about an 85-year-old woman who was so fragile, but she had trouble. She had to switch at the last minute to go back to traditional Medicare. in order to get services. So we don't want to put our seniors through that at all.
Right.
So I just wanted to just indicate that. I don't know if you saw that article yet. It was published, Mr. Hausman, last night on the Wall Street Journal, and I just read it this morning. So there's a lot that's gonna have to be done, and we'll have to continue to look into it.
Okay, good. We're gonna have to.
I'll send you the article.
Yeah.
Right.
I like to ask you.
So what I would say is that, no, I have not seen the article, but I can certainly understand, what's written in the article. So this is a choice in how people get their Medicare coverage. Nobody has to be on a Medicare Advantage plan. They have the option of original traditional Medicare. There's advantages and disadvantages to each choice. With original traditional Medicare, the advantage of that is choice of providers. Right? With original traditional Medicare, you have the most choice. You can go to any hospital across the country, they all take Medicare, as do most doctors. And depending on the Medigap plan, the supplemental plan, you could have pretty complete coverage between the two. But what's the downside of original Medicare? The original Medicare with the supplemental coverage for those that don't have retiree health insurance or don't have Medicaid can be very expensive if they purchase a Medigap plan. Plus, they need to buy a separate Part D drug plan for another premium. So the people in original Medicare with the Medigap and a Part D plan, they pay the most in premium, but in exchange, the most choice of providers, the most complete coverage. What about the other choice instead, Medicare Advantage? You save on those premiums. You still have to pay the Part B premium, but some plans are available for as low as zero additional premium. They include the drug coverage, plus they include some extras that you don't get with Medicare, dental, vision. What's the downside? If it's an HMO plan especially, unless it's an emergency, you're limited to doctors and hospitals that participate, that accept the plan. Even if you don't pay a premium, you pay on the other end when you access care.
That's right.
Co-payment or co-insurance for most services under most plans, up to a maximum out of pocket for the year. Plus, this is managed care, like the article mentioned. And you may need to get pre-approval, prior authorization, before certain services will be covered. So for some people, it makes more sense to have original Medicare with the supplement. Other people do very well with Medicare Advantage. And that's the choice for all people with Medicare to make. And we don't promote either choice. We explain to people about their choices and to let them know about when they can switch their plan. And if you're in a Medicare Advantage plan and you want to switch to original Medicare, there are at least 2 times a year that you're able to do so. Now, during the enrollment period ending December 7th, and a second time between January and March, if you're in an Advantage plan, to switch to another plan or original Medicare. And if you're in Epic as well, Epic members have 1 additional chance each year to switch plans outside of the enrollment period, including switching from their Medicare Advantage plan. So, other questions?
Yes, Lydia, and then Ms. Watla Johnson be next. Then I'm gonna ask you a question.
Just wanted to make a comment. Thank you, Mr. Hausman, for the presentation. But it's a little misleading, and not on your part, but that the Advantage plans may offer some extra benefits like gym membership and so forth. But when you have serious medical condition, you can wait a long time for an approval. You can also have to go through numerous approval processes. So upfront, the cost may be cheaper, but in the end, in fact, we are New York City municipal retirees are fighting this with the mayor in terms of preserving our traditional Medicare. There was a case study of a gentleman who had a heart transplant with a doctor that he had been seeing, and the Advantage plan denied him the right to continue seeing that doctor. I mean, nothing can be more stark than that. So I'm just very wary that certainly the New York City Department of Aging is, even in a sense, promoting it by presenting this.
Yes.
So, again, it's nothing personal. You've done a good job at explaining it, but this should
Yes.
not be something that New York City Department of Aging is promoting. Thank you.
Yeah. And I just wanted to just read one more paragraph, if you don't mind, from the article. People in the final year of their lives left Medicare Advantage for traditional Medicare at double the rate of other enrollees from 2016 to 2022, the journal's analysis found. Those private plan dropouts, 300,075 during that time span, often had long hospital and nursing home stays after they left, running up large bills that taxpayers, not their former insurers, had to pay.
Yes. Mr. Edwards, Chair?
Yes, I'm here. May I ask a question?
All right, yes, sir.
Mr. Houseman, thank you for your thorough presentation. I appreciate it. But I'm actually following up on Lydia Gerson's question. I am a retired New York City employee on the management side. And as has been said, we have been fighting the mayor. I think we've won 4 cases and he keeps appealing to push us on a for-profit, as I see it, a for-profit medical plan. We are quite fine with what we have. Has the Department of Aging taking a position on this?
No, the Department for the Aging has not taken a position on the switch that they were originally going to do to move New York City retirees to a Medicare Advantage plan. But as you know, because of the lawsuits, that's currently on hold, and everybody it's status quo for their coverage. With the exception of the change that I was talking about with the GHI Senior Care, adding the new $15 copayments starting next year. That was actually going to be implemented a few years ago, but there was a lawsuit about that as well, and it was put on hold. It was actually implemented, but then they stopped it, but now we're back to that for 2025.
Yes, I have that letter on my desk as we speak.
Oh, okay, right, from the Office of Labor Relations, yes.
Yes, the co-pays, all the different co-pays we have to assume. But, just after 40 years of giving service to the city, I think we're being treated very poorly. And that's just, my feeling, because in your golden years when you need coverage, now you're jumping through hoops and different approvals to get it done, where we're quite fine with that. We're going to keep fighting the mayor on this. He forgets that he was a civil service worker himself, but we're going to remind him for sure. Thank you for your time today. Appreciate it.
You're welcome, sir. Thank you.
Yes, I like to say one thing, Mr. Hausman, about how the finances that our seniors accumulate is being dragged into the medical. Nonetheless, market rate prices going up for where they live at. There's not enough senior homes built, with a real affordable price, like, in their price range, not something out of the blue context. And it's a drainage. And I think people gonna start to stand up. And one day you're gonna wake up, it's gonna be a huge stoppage in medical and housing facility until they get right. I think people gonna get real tired of it and be out, just like they vote, they're gonna be out in the streets complaining and wanna fight against this increase that seems to match. Cause I look at it differently. I look at the Dow Jones, Standard & Poor, and the NASDAQ. And I see where the hospital municipality is running on NASDAQ system and converts the language to the money system that has our seniors' finances being pulled in that direction, leaving bills after they done switch to another program to accommodate them. They still got bills backed up. Okay, I just wanted to say that is very clear and it's out there and it's real.
Right, so on our end, our counselors are always screening people to see if they can qualify for the programs that I talked about today, the extra help, the Medicare Savings Program, the EPIC, to see how we can save them money on their Medicare costs. That's what we're able to do on our end. And we also help them and encourage them to compare plans, because now is the time to compare plans for next year to see if they might be able to save by being on a different Medicare Advantage or our D drug plan and the supplement plans as well. So these are all things that we're able to do on our end to help people with Medicare.
May I make a statement?
So I attended the hearing on October, I think it was 22nd, with Walter. We just happened to both be there at Settlement House. And he had an opportunity to testify, and I think some commissioners were there, from the state and the city. And actually, fortunately, Walter kind of spun into this, and he talked about medical costs, and it's a pressing issue. So he kind of got it out there that for this district, this is a prime concern.
Yeah.
Yeah, and I thought that went very well. So every year they hold these hearings, but they be brought up once again, next October. Yeah, thank you.
Well, we do, this seems like the west side is lacking in the privilege of having what we need from arts and culture to medical. It's like everybody else is in Central Home, which is a large portion of the city and everything. But it seems like the funds that we have here it needs to come out somebody need to say something about it so we can start trying to implement our visions and impact some of these areas that, even though it may not be slated for us, but to say something is to impact the community to know that we need that there, even though we don't have the space. The words gotta get out. Words are powerful. We gotta get the words out.
May I make a statement? I see this as, this might sound a little, I just wanna make a statement. It's like that commercial that says, what's in your wallet? And what's in your wallet, when we look at income per capita, you have to know how much I'm making, so now you can decide how much you are going to take from me. If we go into any store, a barbershop, or any place else, they have to have a sign, this is what we charge for this service. But no, what happens in this rate, we need to have a better look at the fact that we were also given a check that we have not been able to cash. We paid FICA to all of that, and FICA took a lot of my money. I think that they said, and I was willing to pay it because I thought that they were guaranteeing me that I would have medical coverage, and that in my golden years, that the income and the rate of inflation would not expect my living, as I became a senior citizen. This has not been true. And I think that with the Department of Aging, as we are about to protest, I think that the Department of Aging should take a review as to what their stance is. And I'm not saying, Ms. Hausman, I'm not saying that that it's your fault, but I want you to know that in our community, we don't have a very good view of the promises made by government.
There'd be no soups and sandwiches over here in the west side.
And we worked very hard, and made even harder for people because we were taxed at a higher rate than we could afford.
That's right.
Exactly.
That's it. I'm finished. That's, I'm done.
Is that the close of your orientation? And we gave the response.
So we thank you.
And we appreciate you coming. We definitely appreciate the update information of your orientation. And we have taken everything into consideration. You heard the responses. And thank you very much.
Okay, thank you for allowing me to speak with you today.
have you sent all information to the chat?
Yeah, so I put in the chat the information on the Medicare Savings Program and the Epic online application. And I have our phone number if anybody has questions.
We want to write here, and then
Two
just,
four four, 212-244.
Okay, hold on. Yeah, in a little.
Yeah, you take a picture?
Oh, 66969.
Oh, okay.
Ask for a high cap.
And that's for high cap.
High cap.
And he made reference to a sheet,
That,
an info sheet.
yes.
Yes, I included a link to the Medicare Savings Program information sheet in
Okay.
the chat. And
MSP
also a link to
info.
the online Epic application.
It's a PDF file that, I believe most of us have downloaded. You need-
Mr. Hausman, is that the sheet that was distributed at the meeting on November first?
No.
Okay, thank you.
Sure.
Yes, dash sheet, dash, put it in case, NY in case dot PDF.
Thank you, everyone.
See you next time.
Thursday. It's not just like we never separate from each other.
It's all right, it's all right.
Thank you.
Get used to it. Hi,
Hello,
and you are,
Officer Ann Cardenas from the Community Affairs and the Chief.
okay, I got some, yeah, they sent me something out, okay. I was looking at the name, okay, that name looks familiar. I'm the former TA president, and now co-chair of the Senior Action Committee,
Okay.
and also part of Arts and Culture Community
Oh,
member.
wow.
So I'm moving up there.
Yes, you are. Wow.
Right. So what precinct?
The two
2-6.
oh, the 2-6.
Community event?
Yep.
Jason Hopper and
Yeah.
Detective Uranus.
They retired.
Yeah, both of them?
Yeah, they did, yeah, both of them.
Wow, welcome.
Mhm.
Yeah, I worked with them for like about 12, 13 years.
Yeah, sad to see, especially Jason go.
That was my guy.
Yes, I'm still in contact with him.
You be the home girl, so, you know, I'm gonna start keeping in touch more, and
Yeah.
start showing up.
Okay.
Did you sign in?
Perfect, yes, I did. Yeah.
So you have an update on crime stat?
I do.
We open the floor up to, Officer Cardenas. Cardenas, yes.
Good afternoon.
Good afternoon.
I'm glad to be here.
Glad to be here.
And, yes, it's getting cold now, right? Yesterday was the first day I was like, oh no, it's.
And now it's windy.
Yes, and now it's windy. So I wanted to discuss our crimes versus this year versus last year, okay? So I want to say we're down. We're down this year versus last year in the same time period. You know, we still have a couple months, a month or so to go.
Yes.
So what we do is, I'm gonna just go over the 7 top crimes. And we have murder, this year we have 1 versus last year, this time. Okay, for rape, we have 6 versus 9 from, this year versus last year. The robbery, we're down 111 versus 124. For the felony assaults, we're down 154 versus 157.
This is felony.
Mhm. Now, our burglaries were down, okay? 46 versus 80.
46
Versus 80, yep.
80, like, that's rape,
No, so for that one, that's our burglary.
that's burglary.
And then our grand larcenies, all right, we are down also 294 versus 332.
294,
Mm-hmm.
332.
Now, our grand larceny autos, the theft of vehicles, you know, unattended vehicles or breaking into vehicles, jump starting them and leaving, is 39, we're down versus 97.
Wow.
That's good.
Yeah, so a total of those lists that I just mentioned, we're down. We got 651 versus 799 from last year.
And what was-
Doing the work.
for felony assault, we're down to 154 to what?
from 157.
Okay.
I also want to mention that we're putting together and I did send it to Ms. Prince already, and I did get some calls already. A Thanksgiving older adult luncheon,
Right.
okay? And I have the flyer, I'm gonna leave it here, and it's just so I can say it out here on the group.
What date is it?
Saturday, November 23rd, from 1 p.m. to 4 p.m. And the Reverend, was she was very kind to loan us her church, the Antioch Baptist Church.
Oh, Antioch, okay.
Very close to all our seniors.
They just redid, Antioch, right?
I think,
Yeah.
CB9 sent that flyer. out.
Yes, yes, she did.
Yes.
Yeah.
And it said you have to register. though.
Yes.
Okay.
Yeah.
What's your max?
So listen, I said she said she can squeeze in 100 people,
100?
so much.
That's not, it's a lot. Oh, it's 2-6? They got projects and everything over there too?
That's not much.
That's not much.
A little over 100 people we can squeeze.
Mhm.
Yeah, that's not much.
Okay.
Consider, I'm talking about.
Oh, I know, and I know, that's why I'm really I'm going all the way to the polo ground, you know, to Douglas, I'm going to Drew.
I'll put the flyer up.
Okay.
Do the organization have to, or they can individually register?
They can individually register.
Okay, so I'll take a.
They have to register.
Yeah, they can do it with the organization, and then the organization can contact me.
Those are dinners that they're serving at Antioch, is that what you're
Yes,
saying?
that's where it's gonna be, that's where we'll be serving our Thanksgiving
Oh,
food. And it's gonna be, it's gonna get catered to, nice plate if they wanna come for seconds. And we encourage it.
okay.
And you do have an elevator there, correct?
That's the first floor. Okay,
Oh,
I
that's
showed
all.
everyone.
Yeah, that's made for that.
Okay, and we have our own bathroom.
Okay,
That's fine.
okay.
So, are you offering, yeah, is it on?
Yes.
Are you offering free turkeys to anyone in the neighborhood?
Yes.
Where?
Okay,
When?
so the dates, let me look at the calendar.
When and where?
When and where, yes, so we're gonna do it at the 26th precinct. And let me just look at the calendar. I haven't done the flyer yet, but we're looking, because I want it very close to Thanksgiving, where it's not sitting and taking space in someone's freezer or refrigerator or sink for very long, but I also want it to be something where it's not too close for, you know, now it's like, oh, I'm pressed for time. So I'm looking for November, right, Sunday, November 24th.
November?
24. Fine.
That I'm not sure yet,
Okay.
not sure yet.
Yes, 24 to 72 hours.
Yeah,
Go out.
and yeah.
Do you have to pre-register for those turkeys, or can you just?
They're online, I think, just come on.
Yeah, first come, first served.
Okay.
First come, first
And the
served.
max is,
300.
okay.
300 turkeys?
Three turkeys, okay.
That's about right.
I'm working on some groceries.
Okay.
300.
Okay.
The luncheon is 100, the food is 100 and,
We still work with 2-6
uh-huh.
and do the
So
turkey
since
on.
it's gonna do the 3-0 is probably gonna do it also.
Oh, yes.
Yeah.
Yeah, it's gonna be real, do it too?
Yes.
It'd be no hunger
Yeah.
for Thanksgiving.
Okay,
Have it
great.
Afterwards.
Great,
And this,
great.
this been for a long time.
Yeah.
Cause, at Grant, as a TA, I used to match Grant houses. If it was 30 or 40 that Grant went,
Mm-hmm,
we'd get 30
mm-hmm.
or 40.
Wow.
So instead of having just 30 turkeys, we have 60 to 80 turkeys.
Right.
So,
Mhm.
and don't forget, State Assemblywoman Inez Dickens and the 30th precinct, 2-6 precinct,
Yeah.
PSA 6.
Mm-hmm.
All of them had contributed to keep, hunger off the streets.
Right.
For Thanksgiving and kept the crime down. 'Cause
Mhm.
we made sure our youth and Grant, to this day now, we still speak up for them to have something, buy 7 boxes apiece. So,
And WHDC also contributes turkeys as
The
well.
WHCC?
Yeah, I didn't.
What do
Okay.
they have there, you know?
Well, if they did like that, I know in the past, I don't know about this year, they've given turkeys to the 26th precinct, to the 30th, and to
Oh, they
other.
do.
Oh,
Right, they did the course distribution with,
2 precincts, okay.
Right.
Exactly.
That's right out of it.
So now they go to
No, let me just put it out here, they're the ones that are supplying the turkeys.
Oh, okay,
That's big.
Okay.
That's big.
okay.
That's a continuation and an increase
Mhm.
of what was when Kofi was doing.
Mhm.
Okay.
So he got it popping.
Mhm.
Okay, very good.
Very good, very good.
That's good for me.
Yes, good.
Personally, yes.
Yes. Working.
So my Girl Scout meeting is meeting on December seventh, and we look for our church or something, so it doesn't be a cost factor for us.
So, okay.
December seventh, we meet the seniors, and we open it up to everybody.
Mhm.
And we're working on, I mean, obviously, a turkey is better than no turkey.
That's
But we're
right.
working on getting decent sized turkey.
That's
You know,
nice.
something
That's
that doesn't, takes forever to thaw, forever to cook, you know, something that'll feed the whole family, but it's not overly,
Like
like,
18
yeah,
pounds.
but, you know, it's
That's
something.
a good 18, 20 pounds good.
So, Officer Cardenas, that's what I'm saying. You are, also going to include like not just the turkey, but you're going to try to add like
She said she's gonna look for groceries. She did say that.
Mhm.
the groceries.
Mhm. The supplement.
Yeah.
Mhm.
I wonder if, Princess Amina Amir from Columbia University, we did some work with her. And I mean, she did,
Who's that?
a princess from, Saudi Arabia,
Mhm.
she was lavish with us at one point, you know, during the pandemic.
Mhm.
And, she did a lot of distribution on a large scale.
Mhm.
Like every household had at least 25 pound bag of rice. And,
Oh, yeah.
She just, yeah, so hopefully, I don't know if she's still there, but Mike can ask her.
That's-
Or I can send you her name and stuff after the meeting, and see if you can contact her, if she's still in there. And also city council and,
Yeah, they do too.
yeah, make sure we all get them on, cause I did.
Mhm.
I talked to everybody, even, your congressman, Adriano Espaillat,
Yeah,
He gives.
he did big, he normally be at the state building
Yeah.
when he,
Yeah.
so.
yeah.
He also brings locally too. He gave us every year too.
Yeah, he gets the whole congressional district.
Right.
Oh,
Did he tell y'all to come to the state building?
No, he actually has distribution there.
That's beautiful.
And
Oh,
Francine,
he
this is last year, Shauna Brady's office, also they came to yours and came to us too.
Shauna Brady.
I remember that, yeah.
Shauna Brady.
Cause I remember he called and said, can you use some turkeys? I said, yes, meeting at Riverview,
And-
I said, yes,
Adriano is-
and got them right over,
I'm
so.
trying to coordinate it, and they give me their date with the dinner we give them, the senior committee gives the building.
Oh,
So
when is
that
your dinner?
the seniors gonna feed them, not the Girl Scouts, Girl Scouts
Yeah,
December seventh, but the senior committee's the 21st.
21st?
Yeah.
Okay.
Mr. Higgins, did you have an update?
Yeah, I'm happy to show the programs that we, so again, I'm from George Street Library, and the programs that we're offering are mostly regular ones, that we offer every month, so, computer basics are probably our most popular program, especially for seniors, so if you have questions about anything computer related, including even like stuff on your phones, we have drop-in, every Monday and Friday from 2 to 3. Those aren't one-on-one appointments, it's sort of, we help whoever comes in that hour, but, you guys have a little bit of time. We also do one-on-one appointments for people who need more, personal help. We're changing, starting in December, we're gonna change the format for that, so it used to be you had to register in advance, but we found, it took a long time, like, you know, it would book out weeks and weeks, but then a lot of people wouldn't wind up showing. So it's starting in December, on Tuesdays, it's gonna be first come, first serve. So we can help 2 people, it'll be a 45-minute session, so every Tuesday, starting at 12, when we open, you can show up, and if you're one of the first 2 people, you get a 45-minute, one-on-one appointment for computer help. We also have, we have a virtual crochet and chat program, so that's twice a month. The next meeting of that would be on November 20th. We have an afternoon movie, once a month, so we're showing The Way We Were on November 23rd. And we have a book discussion, every month, this is gonna be tomorrow, November 13th, at 12 o'clock. And then we're trying to do one art program, a month, and this month we're gonna do holiday card printmaking. So we're gonna use the technique of printmaking, so you'll design your own holiday cards and then print them. We have really nice cards and envelopes, so if you wanna send out a personalized greeting card, that program is gonna be November 21st at 2 o'clock.
Card,
What's the
printing,
virtual,
Crochet?
yeah, so I can put that.
Sure, that's,
and
Can you just send me the link?
sure, I'll send you a link to the calendar, but for anybody who was wondering, it's twice a month, but we met on the 6th, it's gonna be again on the 20th, that's 2 o'clock.
Or what?
It's usually, what is that, a Wednesday? Let me see.
No, 2 o'clock on Wednesday?
Well, yes, Wednesday the 20th,
Okay, that's good, okay.
not every Wednesday.
Yoga's 2 o'clock on Tuesday.
Yeah.
could you please repeat for me the date, the holiday card printing?
Sure.
What date is that?
Yes, that's Thursday the 21st. at 2 o'clock.
Thursday, November 21st.
And they will not come, they won't be able to come back out anymore.
Which is this crochet? I don't think so, as far as I think Velda, who's the main one who did the crochet, is still, she's working in the Bronx now, so it's.
Because the square, my square up there, they are still
Yes.
looking to do crochet ornaments
No.
for the
That's
kids.
what
They
I'm
really
thinking.
like that.
So we have a lot of
And I
seniors
wanted
that
to
are
go to the school
homeschooled.
printing.
Okay, thank you.
We could do a vote
And that's-
and donate
Yeah,
to
thank
the
you.
children.
Yeah, Velda was the main one who led that, and she was, moved to a different
Groups.
Yeah,
But I'm gonna get on,
Okay.
see
okay.
what, if she can send me a pattern or something.
Okay.
Even if I could do it. So, and we posted it, computer class, and then we do. You can, let other people know about it, so they can. come.
Sure, yes, so, Francina's mentioning that, 2 times a month, we, staff from George Bruce, go to 3333 Senior Center to offer computer help as well. So if you live in 3333, or if you're close to this area, you can also always show up there. It's the first and third Wednesday of every month at,
12:30,
12:30.
1:30.
Yeah, 12:30, 1:30.
And we have our computers, so. If they need,
Skills.
welcome,
The first and third Wednesday, at what time is that?
12:30 to 1:30.
We have Vanessa Kaufman, Nessa?
12:30.
That's you? Oh, you supposed to do minutes, Walter says something about y'all collaborating. Minutes, the notes,
Friday.
Okay, no, cause I'm doing all reminders like when he left. So, I'll be able to, to handle, everything.
Okay,
And I have, one announcement before, we ask any additional, information needs to be put out or comment statement about, complimentary tickets to the Vision Contemporary Ballad is for, to present for, it's called
Ballet?
Love's Sake. Yeah, ballet. Love's Sake at Riverside Theater. So some tickets was left for Walter and I. Well, Walter's I consider Walter the lead cheer. I'm here to support him and things of that nature, when he's not here.
so that's.
But if need be, I'll pick up, they giving up to 20 tickets, you have a group. You can get a group, I'll get the group tickets and things like that, and we, disseminate it.
What day?
It'd be, November 15th and the 17th.
And 17.
Yeah, performances are on Friday and Saturday at 7 PM and Sunday at,
Friday and Saturday.
and Saturday at 7 PM.
Yeah, I'm with you.
And Sunday at 3 PM.
Sunday.
So it said, please let me know which performances you would like to attend, and if you would like.
I'm a little into ballet. So who's performing?
It's Visions,
Vision is the name of it.
Visions, all caps. I don't know if that's an acronym or.
Okay,
And what
And I
was
will, it'd be at Riverside Theater. And if anybody, get a group, you can email me at CarltonDavis64. And I'll pick them up for, for those who would like to go. And, give it to a group. That sounds good.
Mr. Davis, I'm sorry, can you repeat the one for Saturday again?
Saturday is at 7 PM.
What's that? I'm sorry.
ballet
Yeah.
at the Riverside Theater.
7 PM. Performance are on Friday and Saturday at 7
That's
PM.
church.
Okay.
And Sunday at 3 PM.
Friday, Saturday, 7 p.m.
What's the date again?
The dates are November 15th
Okay, y'all.
And
and the 17th.
Turn it down.
Some of the kids, you know, I usually like the explorers.
You want everybody to get a piece of the audience. It helps.
Yeah.
It's good for everybody, yeah. Yes, money with children.
Is there any more additional, comments need to be made?
I
for-
have one,
Before old business, new business?
no, sir.
Yeah, no, you don't have nothing actually to say, no comments?
No, I just have, I just wanted to, mention, that we are beginning up on Sugar Hill, which is at 147th Street at the division of St. Nicholas Avenue and St. Nicholas Place is a square called Donovan Square. We have just formulated, which is a 3-0. We have just formulated a group called Friends of Donovan Square. And it seems for the last 3 years, we have been unable to get funding. So the Friends of Donovan are out of pocket going to pay for lighting in that square and for the banner which will read Happy Holidays from Sugar Hill. We will be accepting all donations. We definitely could use any donation, and we hope to, our project.
Bulbs and stuff like that.
We just want lights. The only thing we're looking for, I didn't make the flyer yet. All we want are lights for the trees that are existing in that square. And we want a banner that goes across the front of it, which will read Happy Holidays from Sugar Hill. Now, the Department of Parks had said, if we can get that much, they will now give us a tree, but before they wanted to charge us $700 for a tree.
But you don't want bulbs or nothing like that, you just want lights and the banner. right?
We want we don't want bulbs.
You put bulbs on trees, so I'm asking the question.
We'll take all donations. We are not too proud.
No, I'm asking that because I may have a couple.
That's why I'm saying, and we accept that, I appreciate it.
Okay.
Thank you so much.
Okay.
If you have any lights that outdoor
No,
lights.
no lights, baby.
Okay. We take those too, and I'm putting it out there for you, so I want you
No
to know.
lights.
My name is Patricia Caldwell, you can always, I'm on the email, contact me, we really, would like to get this established as a historically preserved neighborhood,
Of course.
and want to make sure that we stand out. I thank you, thank you,
So that goes.
thank you.
Okay, I think we have concluded. Everybody has all their questions and responses. And all information that's been updated has been done. Old business,
Old business.
new business.
Well, you wanna talk about the plays we just did? Okay, the coalition, the MCB9 coalition, WHOAA, West Harlem Older Adults Alliance.
Whoa,
Huh?
whoa,
Whoa.
that's what I call it, whoa.
Successfully taken 250 adults, older adults to Lion King,
Beautiful.
Yeah.
on two
That's what I'm
separate,
talking.
days. And that was very successful. So y'all went on the 9th, I went on the 27th, it was great. It was great. And then we also had, Harlem School of the Arts, the Mean Girl play, which is still going on. And everyone raved about it. I'm gonna give me a ticket so I can go. But the older Girl Scouts went on Friday night, which was definitely meaningful for them with the leaders. And it was fantastic for that age group.
That's the coalition?
Huh?
That's the coalition?
Yes, it was for us.
But I'll look for it,
Yeah, he said about the link. It was the 7th, it was the 7th through the 17th. They canceled the 7th, so I couldn't go because I left town on the 8th. But it was the 8th opening night, and it was y'all stop it even. I'm coming in a minute. Oh,
You're in the meeting.
huh? Yes, fitness kids, yes. 11 of them, okay? Got it? Fine. Getting ready to go to class at 2.
Okay.
Oh, They said it was an excellent plan. We can go online right now and still order the tickets.
Oh, okay.
So,
Okay.
good, so these are complimentary tickets.
Yes, they're free. They're free. And once you order it, then Joanne at West Harlem. Development.
I didn't know about it, that's why, and you
Oh, no,
should
he said it. He said it out.
You didn't see it either?
No,
No, honestly, he sent out the link.
Okay, I'll look for it, I didn't see it.
Yeah, go look back. I mean, it was right in the middle of the two Lion Kings.
Maybe that's why, because I was so
Yes.
busy trying to deal with.
okay, I'll go back to that,
Yes,
yeah,
yes.
Mhm.
And
Thank
then
you
just
so
go
much.
on the site and just register how many you want,
right,
and then she'll confirm your ticket number. And you can only select the groups that are listed, and that's us. You know, and they know that West Harlem Development is paying for them. So your site will be listed on the drop down. You just select,
okay,
I did 3330 senior committee,
okay.
and then I did 20 for this date, 10 for this date, 7 for this date.
So this community board with, the senior issues committee would be listed on that drop down? Thank you.
Yes, CB9 is listed. CB9 is listed, because Walter's on the committee.
Yes,
Yes,
thank you so much.
yeah, they said it was fantastic.
Good, yes.
It was an African school, girl play called Mean Girls. And they said it was fantastic.
Wonderful, wonderful.
Yeah, I have to do me, because I didn't see it, because I was out of town.
Okay.
So I think I'm gonna go on Saturday. It was a 2 o'clock Saturday, but y'all couldn't have gone, because y'all went to the Lion King. Okay, I think
That's it? Let me call for
I
adjournment.
move that
I-
we conclude,
Adjourn.
adjourn.
Second.
The second is done by Reverend, yes, how you doing, Lydia?
She's usually the first, and I'm usually the second, she's the second is kind
Go for it, you don't have to.
You're cold, so moved.
No, I'm just saying goodbye, everybody. I guess I'll see somebody there tonight.
Good to see everybody.
Happy Thanksgiving, happy holiday. Yes. Happy holiday.
Holiday, it's really good to see you, Lydia.
To tap into if y'all can. No problem. Just let me know you're coming.
And,
See you later, guys.
See you.
Can I have one of your flyers now?
Absolutely.
And when is that, and she stop recording? Stop recording.
Yeah.
I'm gonna see if they can make it.
Goodbye, everybody, thanks for joining.
Okay.
Say yes.